Good day, ma'am.
Good day.
Allow me to introduce myself. I am Chenaros Baquero, a student nurse from Biliran Province State University, and I am here to discuss all about hypertension. So we have a PowerPoint presentation and a flyer for you to be able to understand more about the topic. So I was assigned to discuss the three objectives, define what is hypertension, risk factors for hypertension, and common symptoms of hypertension. First, let's discuss what is hypertension. Blood pressure is the force exerted by circulating blood against the walls of the body's arteries, the major blood vessels in the body. Hypertension is when blood pressure is too high. It is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. So let's go on to risk factors for hypertension. So there are two types of risk factors for hypertension. The modifiable risk factors and non-modifiable risk factors. The modifiable risk factors include lack of physical activity, unhealthy diet, being overweight or obese, drinking too much alcohol, sleep apnea, smoking and tobacco use, and stress. So first is lack of physical activity. It is not getting enough physical activity as part of your lifestyle increases your risk of getting high blood pressure. Physical activity is great for your heart and circulatory system in general, and blood pressure is no exemption. So the second one is unhealthy diet. Good nutrition from a variety of sources is critical for your health. A diet that is too high in salt consumption as well as calories, saturated and trans fat, and sugar carries an additional risk of high blood pressure. On the other hand, making healthy food choices can actually help lower blood pressure. And the third one is being overweight or obese. Carrying too much weight puts an extra strain on your heart and circulatory system that can cause serious heart problems. It also increases your risk of cardiovascular disease, diabetes, and high blood pressure. The fourth one is drinking too much alcohol. Drinking too much alcohol or regular heavy use of alcohol can cause many health problems, including heart failure, stroke, and irregular heartbeat. It can cause your blood pressure to increase dramatically and can also increase your risk of cancer, obesity, alcoholism, suicide, and accident. And the fifth one is sleep apnea. Sleep apnea may increase risk of developing HBP and is common in people with resistant hypertension. And the sixth one is smoking and tobacco use. Using tobacco can cause your blood pressure to temporarily increase and can contribute to damaged arteries. Secondhand smoke, exposure to others people's smoke, also increases the risk of heart disease for non-smokers. And the last one for modifiable risk is stress. Stress is not necessarily a bad thing in and of itself, but too much stress may contribute to increased blood pressure. Also, too much stress can encourage behaviors that increase blood pressure, such as poor diet, physical inactivity, and using tobacco or drinking alcohol more than usual. So let's go on to non-modifiable risk factors. Non-modifiable risk factors include a family history of hypertension, age over 65 years, and coexisting disease such as diabetes or kidney disease. So the first one for non-modifiable disease is family history of hypertension. If your parents or other close blood relatives have high blood pressure, So there's an increased chance that you'll get it too. So the second one is age over 65 years. The older you are, the more likely you are to get high blood pressure. As we age, our blood vessels gradually lose some of elastic quality, which can contribute to increased blood pressure. And the third one is gender. Until age 64, men are more likely to get high blood pressure than women are. At 65 and older, women are likely to get high blood pressure. And the last one is chronic kidney disease. HBP may occur as a result of kidney disease, and having HBP may also cause further kidney damage. So let's go to the third objectives, the sign and symptoms of hypertension. The first one symptoms is recurrent headaches. Headaches are fairly common among people with or without hypertension. Some people with hypertension notice changes or worsening of headaches when medication are skipped or when the blood pressure becomes higher than usual. Headaches associated with hypertension can be mild, moderate, or severe and can be a throbbing nature. So the second one is dizziness. People with hypertension may notice dizziness in relation to medication doses and blood pressure fluctuations. So the third one is shortness of breath. The shortness of breath, hypertension can cause shortness of breath as a result of the effect on the heart and lung function. So here are also rare symptoms of hypertension. Blurry vision or other vision disturbances. Blurred visions and vision changes are warning signs that you could be at risk of a serious health problem such as stroke or heart attack. And the second one is headaches, dizziness, and nausea. The last one is nausea, vomiting or loss of appetite. Nausea associated with severe hypertension can develop suddenly and may be associated with dizziness. So, thank you for listening, Mom. That's all, and um, I hope that you learned for this discussion. Thank you.
Thank you.